Hello, everyone. Welcome to NHPPA Talk Forum. I'm Shawn Buckley with the NHPPA, and I'm very pleased to have as a guest Sydney Ross Singer. And just so you know, it's got to be decades ago where I listened to Sydney lecture on a radio program, and I was just mesmerized, actually to the point where I made some lifestyle changes based on what he said. And I found myself thinking about him about a month ago and thought, I wonder if he's still around, and tracked him down. He is a medical anthropologist, and I'm going to have him explain to you what that is after I kind of introduce him a little further. But it's just a fascinating field, and this show is going to intrigue you, and likely you will choose to make some lifestyle changes for your benefit. So Sydney, you have graduate training in biochemistry. You have a master's degree in anthropology. You've decided to become a medical anthropologist, and I'll have you explain what that is in a moment. But to kind of help you be a medical anthropologist, you actually decided to go to medical school. You went to medical school in, if I recall correctly, it was Dallas for 3 years.
No, it was Galveston, University of
Galveston,
Texas.
right. Okay. Well, at least I got the right state.
Right.
For 3 years. But you didn't finish that because you ran into some really some animal rights issues. And I was kind of intrigued about that. Just so everyone knows, we've done another interview with Sydney, but we're going to hold that one off until October, which is just absolutely fascinating, on a link between wearing bras and some significant health issues like breast cancer. But Sydney, do you want to share with us kind of that experience in medical school?
Oh, yeah. Actually, I went to medical school as a standard student, interested, believing in the medical model, the Western medical model. But I had background in biochemistry at Duke, where I was a grad student, and an undergraduate as well, a lot of experience in laboratories. And I learned a lot about the underpinnings of medicine, what's behind the biochemistry of medicine, and there's a lot of animal abuse that goes on there. And I was exposed to that, and it was very impactful on me. Just seeing dogs and cats suffering in laboratories and so forth. I mean, it's still a trigger for me. It was very traumatizing. And I left biochemistry for that reason, and that's why I went into anthropology, because that gave me a perspective of the world that was bigger than the cubby holes of natural sciences like biochemistry. It showed that there are different ways of viewing science, even, and viewing research and viewing everything. So I was very attracted to that because I was so turned off by what I was seeing in biochemistry. And then I realized I couldn't really make a living in anthropology my way, because a lot of anthropology studies cultures and sees what's wrong with them, how they operate, but doesn't do anything about it. And I'm much more interested in trying to improve the world, not just study it academically. So I left anthropology. I got a master's after that, like you mentioned. And then after a few years of working in some other industry, I decided to go to medical school, and I was accepted to University of Texas Medical Branch at Galveston. In their MD PhD program, I was going to study medical humanities and get that with my MD degree. And I spent the first year in medical humanities, and while I was doing that, I was preparing for what I was going to have to deal with in medical school, which are these dog labs. And this, now we're talking about in the late 1980s, where the cultural sensitivities towards animals were a lot less than they are today. It's a little bit better today, thanks to the efforts of people in my generation fighting these animal rights battles. But I was not into animal rights at that point. I just didn't want to participate in these dog labs, which are demonstrations of certain simple physiological principles on a dog that's killed at the end of this. And it's just, actually, it's like a rite of passage in medicine. I was told that, literally, in quotes, you need to feel and smell the blood on your hands to become a doctor. And that just seemed counterintuitive to me. to become in the healing profession, become a doctor and be a sensitive, compassionate person. I didn't think you needed to do any torturing of animals and any animals experiments like that. It wasn't even an experiment, just a demonstration. So I asked to be excused, and they wouldn't excuse me because they felt that the people I was asking for an excuse from, these dog labs, were animal researchers. In fact, the guy who ran the lab was a burn researcher. So he burned dogs and then would study how to maybe deal with the burns type of thing. And they didn't have a lot of empathy for animals. Needless to say, they couldn't do their work. So they saw any challenge to what they were doing as a slippery slope. And they always had a guilty conscience of what they're doing to animals, because there are animal lovers everywhere that object to that. So I ended up having to fight for my right not to participate in that. And the ethicists in my medical humanities department failed to support me, even though they did verbally. They wouldn't stand up to the university with me because they said, I get a paycheck from the same administration. I can't put my career on the line for you. So I was on my own, and I fought, and I threatened a lawsuit if they would force me to do this. I said, if it was an abortion you were asking me to do as a medical student, and I objected on moral grounds, you wouldn't force me to do an abortion. Well, I'm objecting to this animal experiment demonstration on moral grounds. I don't think it's necessary. And there are ways to teach this without that. Anyway, that made me a pariah on campus. I was blacklisted, and I started writing more and more about how bad medical education was. And no preventative medicine training, no nutrition, nothing. I mean, it was just, you're learning how to identify conditions for drug prescription. That's what it is.
Mhm.
And I became more and more like, one day in class, for example, and all the students were afraid to talk to me. The faculty was afraid to talk to me. I was really blacklisted out of a class of 200 students. And like one day I was told by a professor that one of the biggest predictors of disease is income. Poverty is highly associated with disease. So I raised my hand and I said, well, shouldn't that mean that as doctors, our responsibility should help to fight poverty? I mean, we're trying to prevent disease. If that's how you could prevent it, we should be involved in those types of things too.
Mhm.
Well, that didn't go across very well. They're not interested in anything other than the biochemical model of medicine, which I learned as a biochemist. I knew biochemistry. I was getting A's. All the students thought I was already a doctor because my grades were so high. I was throwing off the curve, and I was not really welcome there. So after 2 years of that, I got all my basic sciences. I quit the medical humanities because they weren't helping me, and I had no respect for them after they declined to help me with my ethical problem. And I decided to pioneer a new approach towards understanding medicine, the body, and how to do research. You see, it's just so clear that, and you know this, animal research, which is really the core of medicine. I mean, all the drugs you're taking were tested on animals. All the procedures that they do were tested on animals. And there's basic science too, which is just, we want to see what happens. And they do all sorts of things on animals. And they also know that what happens in one species doesn't necessarily apply to another species. Cats, dogs, rats, monkeys, pigs, all of these animals have different physiology, have different enzymes. You can't extrapolate from an animal study to a human study. You can also see with humans, one drug might affect two people very differently depending on a lot of circumstances, including environmental issues. Well, when you look at animal research, how can you extrapolate from another species if you can't extrapolate from one human to another in their response to things? So it's a lot of false leads, it's a lot of wasted research dollars, and a lot of cruelty. And I think that's at the core of medicine. And you can't expect a humane medical system that is training its doctors in inhumane methods. And I don't think you can actually trust research vivisectors, which is what animal researchers are, vivisectors. They're in charge of the medical world. And in my opinion, to do research on animals as surrogate humans, and in most it's especially in things like psychology research, where they're acknowledging that these animals can respond in some way that helps us predict human response. They think, You wouldn't do it on a rat and do psychology research on a rat if you didn't think it had absolutely no relevance to humans. And so they're using animals as a surrogate, but they don't extend any rights or consideration to the animal's suffering. And they do suffer. And I feel like there's really no difference between humans and non-humans. We're all animals. And I feel that's a real problem, that our medical world is run by psychopaths who have no, or sociopaths, okay, who have no ability, no empathy for these animals. And it's an empathy issue. They can shut off their empathy and torture these animals. Well, you know, in medical school, we were told after the animal research, you got to go on the wards and do it to the patients. And that it's like it's progressive. So you start by doing it on dogs, and then you could start experimenting on people, because you got to do your first procedures sometime. That's what teaching hospitals are for. You do it on the poor patients. So it's always on the least powerful in society, and starts with animals. So I objected to all of that. And then I also knew that 70 to 80% of our diseases and death is caused by lifestyle. That's nothing to do with animals. That's human. Being an anthropologist in training, as well as a biochemist and training in medicine, I integrated them all to create what I call applied medical anthropology. And what that means is, and there are other medical anthropologists and applied medical anthropologists. It's a very new field, though, and it's very scattered. And the way I do it is I try to look for what our culture does to us that makes us sick. And what you need to do then is, when you identify a lifestyle factor, which could be diet, could be a whole bunch of things, stress, lack of exercise, pollution, toxins, it goes on and on, all the cultural factors that make us what we are, because they change our chemistry. These factors they need to be studied in humans, not non-humans. So this became an alternative for me to animal research. It's cultural research into culturogenic disease. That's a term I coined, which means culture caused. And, you know, there's a lot of things that can cause a disease. How do you know if it's culture caused? Well, a good example, which we could talk about. I talked about the bra and issue and tight clothing.
Well, we can briefly go in there, just because it's so important, and it kind of acts as kind of a precursor of what's going to be coming in October. Okay. So do you want to kind of, you know, understanding we've got a whole show on that, at least explain what that is? Because what fascinated me was the comment on the incidence between breast cancer between men and women that never wear bra.
Right. Well, this was actually the first study we did, because when I left medical school, my wife, who ran an animal rights organization, that's how I met her, because I was looking for any support I could get to oppose these animal labs. They ultimately let me out, but, you know, as I said, I was blacklisted. But anyway, I met her, and when I left medicine, we went to Fiji to do field work and see what we could discover. We were interested in medication side effects at that time, but my wife was pregnant, and she developed a lump in her breast while we were in Fiji on a remote island. And that shocked us into wondering, what could she have done? Because that's the way we approach things. We don't think like, what genetic problem do you have? In breast cancer, that's only like 5% of the incidence is due to genetics. So we think of, what could I have done to myself to sabotage my health by my lifestyle? And she was hanging out some bras on the line a week earlier, that on a remote island in Fiji, and a local girl was wondering what they were, never really saw a bra. And my wife had to explain what they are, why you wear them, which was kind of weird to explain. Just, well, we do that in my culture. And then the girls felt it and pulled on. He said, "Isn't it tight?" And my wife said, "Well, I suppose it is, but you get used to it." And then we sort of let that conversation go. But after flying back from Fiji to the United States in a panic because of this lump in her breast while pregnant, we arrived home. We went in to take a shower after a very long flight to California from Fiji. And then my wife took her clothes off and her bra off. And I looked around her breast, and I saw these typical marks that I've seen before, you know, thousands of times, the indentations, red marks and indentations around her breasts and shoulders left by the bra. And this time I was looking for clues, because suddenly her breasts were a problem. So is that significant? Are those lines significant? And yeah, it's not just that's just something you get. those are signs of constriction. And once I started thinking about it that way and realizing the physiological significance of that, that means that could affect your lymphatic system, which is easily compressed and is responsible for removing fluid and toxins from the breast, from all parts of the body. But the breasts have a very important lymphatic system. And it also is part of your immune system. And if the lymphatics are impaired, immunity is impaired. The flow of the lymphatics goes to the armpits, lymph nodes mostly, and the bra cuts that off essentially. So it's like a dam that holds the fluid back. And that causes women to get breast pain, breast cysts, and swollen breasts from this backed up fluid that can't properly leave. And then toxins accumulate in the breast because they can't be flushed out by the lymphatics, which is their normal function. And the immune system can't fight any developing cancer cells, which happens all the time, by the way. Our bodies are constantly making cancer cells. Of the trillions of cells we have, there's errors all the time. But your immune system attacks it and gets rid of it. But that's if you don't tie its hands by constricting the organ that they're supposed to cleanse. So the breasts are basically getting constricted and congested and toxified. And that increases breast disease, including cancer, we discovered, because we did our own study on that back in 1995. We published that in our book, Dressed to Kill, the link between breast cancer and bras, that came out in 95. And since then, there have been other studies around the world confirming it. But there's also been tremendous resistance from the lingerie industry, which has adapted. Now, if you notice, it's much harder to find underwire bras, push-up bras. They're rare. When we came out with this, the Wonder Bra, which is a push-up bra, came out in 1995, ironically, the same year we came out with our book. But now it's harder to find underwires. There's a lot of loose bras. They've gone from toxic fabric to more cotton and things like this. So the whole thing has changed. We actually impacted the bra industry. But the medical industry was worse. The medical industry has like a monopoly on all of these things. And you're not supposed to be able to talk about it unless they approve it. And that's what peer review is about. It's getting the union label that you can talk about these things. And there are peer-reviewed studies on this that show a link, but they're ignored because it's not convenient for the medical world, which, billions are made every year on the detection and treatment of breast disease, breast cancer. Billions are made selling bra.
Let's just say that again, because I can understand the bra. Like you're saying this, and we're all obviously the bra industry is going to be against this because, if you were not wearing bras, your incidence of breast cancer is the same as men because men don't wear bras. So right. If really bras are leading cause of breast cancer, I can see the lingerie industry wanting to shut you up. But the medical industry, that's not so obvious. So say that again. This is fascinating.
Yeah. Well, the sad part of this is that it's become labeled over 30 years. I've been working on this. And it's become labeled now as pseudoscience and debunked and so forth. They came out with a study. Fred Hutchinson Cancer Research Center in Seattle came out with a study paid for by the National Cancer Institute specifically to disprove this link. And they had a select group of older women who were lifetime bra users, no bra-free control group. And in the way they did it, they couldn't find a link between bras, the way they used their bras, and cancer. They looked at women who had and didn't have cancer, and they wondered if they had different bra usage. That's what we did in our study, but we included bra-free women. They didn't include bra-free women. We included
young women too.
Yes, we included premenopausal, and they didn't. And the reason they didn't include premenopausal is because another study came out and found that in postmenopausal women, the bra effect wasn't as great as it was in premenopausal, and they found a cancer link. But this study was meant to disprove it. So they only looked at the negative one to try to confirm a negative finding. And actually, that's bad research. I can go into it, but it's called a survivor bias. You shouldn't do lifestyle research on old people because people who have lousy lifestyles throughout their lives, you took a group of people, gave them the same bad lifestyle. Some of them are going to suffer right away and they're going to drop out, death or whatever. By the time they get old, these are the survivors. Like you'll find some people in their 90s who are smokers and drinkers. And we know smoking and drinking are bad for you, but they lived and they're fine. And how could that be? Well, some people just have a different genetic makeup. They're more resilient. They have more enzymes or better enzymes or whatever. They make it. And you don't want to study them because you can't see that that excludes all the people who were younger who dropped out because they got sick from that. So that's called a survivor bias. So you don't want to just look at old people to see. You see that all the time with articles that say, the secrets to old age, what these 100-year-old people say. Oh, well, my secret is, and some of them will say, they'll eat bacon every day. It's how could they do it? Well, that doesn't mean you should do it. There's a bell curve, and in a bell curve, there are people on the extreme who can get away with stuff like that. And if that's the only group you look at, it'll ignore the rest of that bell that died. So anyway, that was my first study. It got me, it went around the world. I went around the world announcing it just to warn women to loosen up and what could go wrong. But here, this brings us back to what I was talking about causality. So what's causing do bras cause breast cancer? Well, bras concentrate toxins in your breast, which toxins can cause cancer. The bra is causing this problem. It's like setting you up for it. But the trigger could be pulled by different things. I mean, there's multiple factors. All of those could be considered causes. And if you're, whatever your specialty is as a professional, that's where you'll focus on the cause. If you're a biochemist, you'll focus on the chemical causes. If you're a geneticist, you'll look for the genes. I'm a medical anthropologist looking at culture and how we do things that hurt us. And that to me is the bra. And, but then you got to go deeper. Why do women wear bras? And I explore that in my book, Dress to Kill. But why do they wear them? And what is the fashion industry? The fact that the medical industry is invested in not finding new things that challenge their past way of doing things. Like the same with smoking. When smoking and lung cancer were connected in the in the 40s, 1940s, there was such resistance from medicine because the whole culture was into smoking. Doctors smoked, everybody
I'm
smoked.
totally confused because I thought doctors supported smoking and would do advertisements.
They did
smoking.
back then. It took thousands of studies. How many studies does it take to prove a point? There's no one answer for that. If you like the point, it'll take one study. If you don't like the point, it'll take thousands and thousands until you can't ignore it anymore. And then the reason that's a problem for medicine is when they do studies, like a lung cancer study, if they ignore smoking in a study nowadays, you'd say that is a flawed study. We don't know whether these people were smokers or not. How can I compare these groups if I don't know who's smoking and how much? And, that kind of thing. Well, the same thing goes with breast issues. The bra has been known to cause changes to breast health. It causes headaches and skin depigmentation and rashes and nerve impingement. And those things are already studied. They know that. And it causes lymphatic impairment. So, how can you study breast disease without considering the most obvious thing that women are doing to their breasts?
I'm just going to move us on because we've got a whole show on this. And but it's making the point about what medical anthropology is. So culturally, some cultures wear breasts or wear bras, wear bras, and there is a medical consequence to that. So that's a cultural thing.
Right.
And then there's a consequence. That's the type of thing you look at. Another one you've looked at that I did want to discuss is, I go to bed and my bed is level.
Right.
Culturally, we sleep flat. Mm-hmm. That's a cultural thing. Do you want to talk about that? Because it might surprise people that this might not be a good idea.
Yeah, this is another big discovery. And I'll tell you how I came to this. I was lying down and flat, like, you say, and I got up real quick in the middle of the night to go to the bathroom. And I don't know if you've ever done that. A lot of people have. You sit up too quickly and you get a little lightheaded and you have to because that's called orthostatic hypotension. It's low blood pressure because of your positioning. As soon as you see, when you're lying down, I should first back this up. That's what keyed me into the fact that when we're lying down versus standing up, we have a different pressure dynamic to the brain in terms of circulation. And it takes a while when you sit up for your heart to pump a little harder now, because when you're lying down, your heart doesn't pump as hard. And when you get up, it has to pump to get the blood up to your head, because suddenly your head's up instead of down. Now, why is that significant? That's what keyed me into this issue. And what it has to do is gravity. Like the last thing with bras was compression. It's a mechanical issue. Here's another mechanical problem. By mechanics, I mean physics, as opposed to chemistry, which is what medicine focuses on. In physics, the physics of gravity, we are in a gravitational field. Everything in your body is being pulled down. Over time, our skin even gets pulled down. We just sort of melt away down. And as you stand in the day, your blood is pools down, low down to your feet. And people will get swollen ankles and swollen feet because of standing all day. When you lie down, there's a different association with gravity. Now your body is horizontal. And the specific thing to think about is the relationship between your heart and your brain. When we're like this, vertical, the heart has to pump up to the head, and then it goes into becomes cerebral spinal fluid that circulates through your brain, then collects into venous collectors and comes down as venous blood. And gravity assists the drainage because it's higher than the heart, so it helps pull it down. And it resists the pumping up to the brain because you're pumping against gravity. And the brain compensates for this, the heart compensates for this. It's very important that your brain get enough circulation, obviously. So there's a lot of physiological and anatomical mechanisms to make sure you get good brain circulation. The problem is when we lie down, suddenly the head and the heart are on the same level. So now the heart is pumping blood straight into the head, and with no resistance to gravity. So that's why the heart has to pump less hard when you're lying down, or you could pressurize your head too much. There's no gravity drainage assisting. So a major factor associated with brain circulation, which is gravity when you're vertical, is no longer having the same effect when you're horizontal. And therefore, your brain is going to get pressurized. The only way to circulate it is through the pumping of the heart, because there's nothing else assisting the flow. So it has to pump and get pressure through the whole head and come back out. And the bottom line is, compared to when you're vertical, it's very poor circulation. So at nighttime, your head is getting pressurized with not very good flow. That means the cells in your brain and all the different brain centers that are responsible for all sorts of different things in your body, those cells may not be getting proper nutrition because they're not getting good circulation. They're like congested all night in fluid. So that fluid then loses its oxygen and it loses its sugar, and the brain needs that, both of those. And it builds up in waste products. And that's why people feel worse in the morning than when they went to sleep. They're groggy, their brains are soggy, effectively. Their eyes get baggy, their face is puffy, their sinuses are filled, they have to blow their nose. If you're leaning on your ears are also can get pressurized, and that's not good. So your whole head, not just the brain, the sinuses, the eyes, the ears, it all is getting congested. So one of the diseases I thought this might work with is migraines, because a migraine, when you think about what it is, it's not a bad thing. It's actually a defense mechanism, sort of like a fever is a defense mechanism, and throwing up is a defense mechanism to get things out. I mean, our bodies have a lot of ways that aren't pleasant to deal with things. Well, a migraine is not a pleasant thing, but it's essential. And people with migraines actually have lower other brain problems because of this mechanism. What happens is the blood vessels in the neck open up to the brain, and there's tremendous pressure pushing things through to flush it out. Because that's what was my theory, that the purpose of the migraine is to flush out the brain. Why else would it open up like that? And it does it in the morning, when after a whole night of being down, you get a migraine in the morning. That's because your brain doesn't have enough of what it needs. And if you're lying down, the only way for it to get circulation is to open up and pump it through, and to wake you up and have you sit up or get up, get your circulation going. So I did an experiment I was in Victoria, BC at this time, and I did it with some chronic migraineurs. These are people who've suffered from migraines all their lives. And I had them lie on, I elevate their beds, the head of the bed. If they were in a recliner, like if you were sleeping in a recliner, like a lazy boy type recliner, your head is back, your feet are sort of up, but there's an elevation incline from the head down to your down to your waist. There's a bit of an incline. That's very comfortable. And there are inclines that you can do in bed that doctors prescribe for this very reason. They use wedges, foam wedges. They do that for hiatal hernias and for GERD, gastrointestinal issues, because when you're flat, the stomach can regurgitate up the esophagus and into your mouth. So to deal with that, if you put the body up on a tilt, gravity keeps the stomach contents down.
Mm-hmm.
When you go on a tilt, it also means you now have gravity assistance to drainage, so the brain circulation can start flowing better. So I found out that in space medicine, where there's zero gravity, so it's like everybody's flat, they study that on Earth by having people lie flat, actually a little bit head down. And that's simulating zero gravity's effect on your brain. And they know that that's a big problem. And they also know that at 30-degree head of bed elevation, that means if your bed was on a 30-degree wedge or from the waist up is all you really need, 30
Mm-hmm.
degrees, that's optimal for both brain and heart circulation, according to NASA. Well, I tried this with people with migraines, and their migraines went away, like 70% of them. It was incredible. And one of them even told me, I used to use a wedge for GERD problems, and now that I think about it, my migraines didn't happen while I was doing that. And then I started feeling better GERD-wise, so I stopped sleeping with a wedge, and his migraines came back. He didn't put a connection.
Mm-hmm.
But elevating it got rid of them again. So I then did more and more research on the many conditions that are associated with increased brain pressure. And there are tons of them, including sleep apnea, which is treated, by the way, by head of bed elevation. They've done studies that show raising the bed, and that's because your brain stem, which has respiratory centers in it, can become dysfunctional under low oxygen and sugar conditions, and that'll affect your respiration. So if you raise the head of the bed, your brain centers work better. Babies, by the way, who are put flat and on their bellies, as they do in the West with their heads to the side, they have sudden infant death syndrome. And the recommendation was to put them on their backs, and that they should also elevate, like in a crib that goes up for the baby's head. And they shouldn't be flat. But you see, when you put the head to the side, the muscles in the neck impinge on your veins coming down from the brain. So it actually increases brain pressure. They've measured this with electrodes in the brain. When you lie down, your brain pressure goes up. When you stand on your head, it goes up a lot. And your eye pressure goes up too, I should have mentioned, eye pressure. And they've used head of bed elevation to treat glaucoma. But they don't ever do these preventatively. They only wait until you're sick, and then they say, hey, why don't you try this? But of course, that's a low-cost solution, so they don't like that. They want drugs or surgeries. They don't want low-cost mechanical solutions, but they've recognized that they do exist. So sleep apnea, glaucoma have already been treated by head of bed elevation. I found that migraines can, and many people have tried this over the years. I discovered this about 25 years ago, and over the years I've had so many people try it. I've done a lot of radio shows on this. It works really fast, and like within a day or two, you will feel so much better the next morning. Your sinuses will be clearer. You'll be more alert because your brain had better circulation. It wasn't just choked all night. It also, there's the other issue associated with this is sleep position in general. Like, should you be a back sleeper, a side sleeper, or a belly sleeper? Well, let's think about that, because there's a lot of controversy about what's the best sleep position. If you sleep on your belly, think about, you're spending a third of your day, 8 hours, in this position every single day. So sleep is a very important thing. We don't think about it enough because we're unconscious, but it's a very important effect on your body because a third of your life is spent that way. So if you're leaning on your chest, you can't expand your rib cage that well. So first of all, it's going to reduce your depth of respiration. Secondly, you can't have your face down when you're on your belly. You have to put it to the side, which lowers increases pressure in the brain, lowers the amount of the drainage, because you have constriction from muscles in your neck when you turn your head to the side. Another thing, when you're leaning your side of your face into a pillow, you'll discover that over the years, that side of your face, if you're consistently one side or another, that side of the face will start to change shape. You'll be pushing your nose to the other side. Your eye will start going down. I could look at a person's face and typically tell how they sleep, unless they've had some other injury or something, because of the leaning of the nose. I'm looking at you right now, Shawn, and I would say you're sort of a back sleeper. I'm guessing because you don't have any asymmetries that I see in your face.
I'm both sides and back. I just keep going back and forth all night.
Constantly. It's because we're so uncomfortable in those positions at night. If you elevate, though, it makes it so much more comfortable. So the back belly sleeping is the worst. Side sleeping. What's the problem with side sleeping? Well, you're leaning on your shoulder and your hip, and they're going to hurt after a while of years of doing that, decades of doing that. So by the time you hit 60 or whatever, your shoulders are going to hurt. Your hips going to hurt because you've been compressing them all your life when you sleep. Also, it throws off your spine. Your neck has to be, if you're leaning on your shoulder, you have a whole bunch of space here between your head and the bed. So you have to put a pillow there, compressing that ear. That's another thing. You can tell people's ears, if they're really flat against their head, they're usually side sleepers. If they're back sleepers, their ears usually are out more. The shape of the head's different too. If you're side sleeper, the shape of your head becomes more oblong. And in Eastern cultures, they put kids on their back, and you'll notice the back of their heads are flat and they have a rounder head. And our culture has a more elongated head. And it was a shock when they came up with that sudden infant death syndrome advice to put babies on their back instead of on their belly, which made them throw up because of pressure, right? Leaning on your organs. It's another thing. You're on your belly. You're leaning on all your organs. But it was making kids' heads start getting flat on the back and rounder, and that's not a Western look. So they actually were putting these kids' heads in a type of vice thing to make them elongate. I mean, just as you can change teeth with orthodonture and put pressure on your bones makes it change. You're leaning on your bones. You're leaning on your skull. It changes your skull shape. And the way you do it on your baby is going to be very impactful for the rest of their lives because they're very malleable. So how you put your baby down to bed is going to affect the rest of their lives' anatomy. It's going to change the shape of their head. And imagine, what is the brain doing inside a skull that just changed its shape slowly? There are different parts of the brain that are going to have to fit into that skull in a different shape. So it may affect circulation. It may compress in different areas. So these are physiologically significant things affected by our culture, just the way we sleep. So obviously the best way to sleep actually is on your back, because if you think about it, there is nothing on your back that you can compress. It's flat. There's no organs you're leaning on. You're leaning on muscle and just right there. And if you elevate, it'll be comfortable. If you're on your back without elevation, it feels very uncomfortable and you snore a lot and everything. But if you elevate the head of the bed, then it reduces snoring, it increases circulation, and you get so much more comfortable.
Now, let's make it easy for people, because you had said earlier roughly a 30-degree elevation is like a good elevation. So
yeah,
typically, how many inches are we lifting the head of the bed?
Well, 30 degrees. 30 degrees could be. Everybody has to find their own comfort level. If you wanted to try this and experiment, and you have a regular bed with a mattress and a frame, you could put blocks under the head of the bed, raise it about 6 inches on just the head. That'll make a full incline with your bed. Now, I don't like full inclines because I think over time your feet are going to get more congested because they're not getting the opportunity of raising and decongesting from a day of standing. So I don't like the feet down all the time, but that could work just to get your head cleared. And if you're young, it's probably not a problem. For older people who might already have leg circulation issues, I don't like legs down. The ideal is or you can also, let me say, the second one is a wedge. In a wedge, it's half the bed, just the top. So your bottom part is still flat. So your legs aren't down. So that's preferable to elevating the whole bed to make a huge incline plane, which will slide down a little bit. You need to put a pillow under your buttocks to keep you from sliding down. But and pillows, be careful with pillows too, because you don't want a lot of pillows. They crane your neck, they push it forward, they ruin the curvature of your neck, which is supposed to curve out. And when you have a pillow, it curves it down the wrong way. And when you actually do this, touch your chin to your chest, you're increasing brain pressure by the same mechanism of turning your head. You're compressing veins draining. So you don't want a pillow pushing your head like this and messing up your whole spine and everything. Pillows aren't that great. You want a thin pillow maybe to keep your head from rocking, but head of 20 degree would be fine. 10 degree could be fine. Some people, you'll feel it. In fact, the best thing, if you can afford it, would be an adjustable bed, because at different times of different days, you might feel a little more congested than others. Like if you had a big dinner and then too late and you're going to sleep like within an hour or two of eating, it's going to be in your stomach, and that's not a good thing for reflux. And so then you might want to raise the head of your bed a little bit more and have a 30 degree, and that'll really improve digestion. You won't feel reflux at night. And some days you might want just 20 degrees. You might feel like need a little more pressure in my head. At the end of the day, the reason people get tired a lot of the time is because the pressure is low in their brain from being
we've
up all day.
spoken about migraines. We've spoken about sleep apnea. Are there other conditions
Glaucoma.
that you found? Glaucoma.
Glaucoma. And you raise the bed, your pressure in your eye will go down. It takes some time. Unfortunately, doctors immediately prescribe for these things. But if you had no drugs and you were doing it with head of bed elevation, it would work over time. I mean, it's worth trying with the doctor working with you on that. Strokes. Strokes occur in the middle of the night more than any other time. Why? Why would 4 a.m. be the worst time for strokes? It's because you're lying down and your pressure in your brain is the highest it is all day. And then that could blow a blood vessel. If you have like an aneurysm in your brain, a weakening of any of the blood vessels in your brain, they could burst at that time and you can have a stroke. So, and they treat stroke and after brain surgery or anything by head of bed elevation while you're healing to keep optimal circulation. They already know that. They just never do this preventatively. That's the thing. They wait until you're sick to tell you, hey, try that. But instead, if they're wise enough to say it, usually they'll just go for drugs or procedures. But to tell you to change your lifestyle, if they're a good doctor and they care about lifestyle and they knew about this, because they don't teach this in medical school, they would end up telling you to try to change your bed positioning. Don't wear tight clothing in bed too. I mean, that's another important thing. But so that's the issue of head elevation. Migraines, Alzheimer's is another one. Alzheimer's, if you look at Alzheimer's brains, I think that's the end disease of a lifetime of this problem of too much pressure in your brain. Because the ventricles inside the brain, which are these cavities that contain cerebral spinal fluid, those ventricles are swollen in an Alzheimer's brain. In fact, there is increased brain pressure. And they've actually tried doing surgical shunts to drain that brain pressure into your thorax with a tube. I mean, they know there's higher pressure in the brain, but they never ask why. And this is why. I mean, the pressure is related to your sleep position, I think. And after years of this, the brain is pressurized. What parts of the brain getting pressure is going to influence what aspect of dysfunction you're going to experience. Think about this as well, Shawn. If you have, at night, you have melatonin and all these hormones that are circulating coming from the brain. If you have bad brain circulation, how are those hormones going to get around effectively? They're not, it's like your brain is being shut off a little bit at night in circulation because of lying down and keeping it congested and not having a good system going for circulation. So all of those hormones might not get around the same way. So it really could affect so many systems. And that's why I think it makes absolute sense for everyone to try this. Just raise the bed modestly in the beginning. You could do it a wedge with 6 degrees, six inches on the top. It's a very low degree. It's like less than 10 degrees, but you'll feel it. And interestingly, I also knew about this before I got into med school, I was shadowing a vascular surgeon and to see what it's like. And he showed me something with a patient. To assess how bad your heart failure is. Like, in other words, people with heart failure who have inefficient pumping, they need to be assessed for how bad the pumping is. And one way of assessing it grossly is to have them on an exam table, lying flat. And the table bends in the middle. And what you do is you start lifting their torso, the top of their body. And at some point, when they're flat, you look at their neck and the neck veins are sticking out. Your veins will stick out. Like if a person does a headstand, you look at their neck veins, they're like full on, engorged, because they're not draining. They're all backed up blood. When they're lying down, it's backed up. That shows it's not circulating well. So you look and you can see while they're on the flat table, their neck veins are sticking out. As you lift the top of the table and it goes higher and their torso goes up and their head raises, gravity takes over and suddenly the veins collapse and you see that they're flowing. There's no backup anymore, because the only thing pulling the blood is gravity pulling it down and the suction of the heart trying to suck it in. But when you have heart failure, you don't do that very effectively. So when you're lying flat, the veins are sticking out, you raise it, and then you could tell the higher you have to raise it, the worse the heart is working. The more you have to assist it with gravity. That's sort of the idea of that whole thing. So that really, in a nutshell, is what this is all about. I mean, the brain circulates better when it's on an incline. So when you're lying down, just do that. And it'll, by the way, this will affect children's inner ear problems. And astronauts have these problems. Astronauts get migraines, they get glaucoma, they get Meniere's disease, which is an ear disease, because the pressure is building there. And children who are flat and side sleepers will lean on an ear and they'll get ear infections on that ear. And people who sleep on a side predominantly, that eye will be worse than the up eye because it's leaning all the time. You'll even get astigmatism, which is a change in the shape of your eyeball because of leaning on it. And that actually will change the bones around your eye socket and compress your eye. It's because you 8 hours of pressure every day. So this is a real lifestyle issue. Unfortunately, and what's really weird, I mean, keep in mind, in some cultures, they sleep in hammocks. Orangutans make hammocks for themselves, keep their heads up. A lot of cultures would, they'll put rugs down and put their heads up on the rug and their body will be lower. I mean, they try to keep their head up. Even your dog will try to keep his head up on a pillow if he has a choice. It's more comfortable having the head up. And but our culture, because of the way beds are made and the history of that, we just think it's better to be flat. And even adjustable beds are sold. This is mind-blowing because of the cultural bias. They show you sitting up to watch TV or eat in the bed. But then when you're sleeping, they have it flat and the person on their side, like maybe in a fetal position on their side. Like that's the ideal way, is to be in a fetal on your side without any elevation. And that ruins the whole purpose of having an adjustable bed. It's not just to watch TV. It's to, in bed, it's to sleep with your head elevated, and your feet can be elevated too. So you make it so, but you got to understand that whatever's the low point, like your buttocks in that case, is going to get the fluid. So if you have a bad lower back, it could be that elevation causes a lower back problem because fluid will start collecting there. So the moral of the story is sleep position is important. It affects your health. Medicine completely ignores it. If you went to a sleep studies doctor, he won't even think about this. And in any sleep research that ignores head elevation and sleep position, it's like ignoring smoking and lung cancer or bras and breast cancer. This is a critically important thing affecting your brain. And there's no risk at just raising your head 20 to 30 degrees or 10 to anywhere up to 30. You'll feel it. By the way, 60 degrees is called a Fowler position. That's an official nursing thing. This is a semi-Fowler. And if you want to, they knew this. You breathe better. And in that position, they always used to put babies in that position. Back in the days of tuberculosis wards, everybody was elevated. It's like they knew it was much better circulation for your brain and your heart and your head and your lungs if you're elevated. So that's a simple thing to do, and you will feel the difference. And it affects ADHD. We had some anecdotal evidence of a child who had ADHD. She slept like 12 hours a day, was really unruly, out of control. She used to fall asleep in a recliner with her head up and everything, watching TV. Then her parents would pick her up and put her in flat bed, and she would sleep then for hours and hours and hours. We suggested just keep her in the recliner and keep her head up. And they did that and ended up, and I'm not exaggerating, she slept like only 10 hours, and it changed her entire personality. Her school behavior was completely improved. It's like her brain wasn't functioning right because of choking it all night. And then in the morning, they're not ready for another day of elevation with your head up, and it didn't get enough circulation at night. And during the day, you're draining it more with gravity by the end of the day. And this is cumulative. So every day adds up. And eventually you get to the point where you just don't recover as well. And you're just groggy all day. And then you start getting these problems. So that's another interesting culturogenic disease, is the way we sleep and the way we have beds. And even sleeping those long lengths of time, 8 hours straight. I mean, that's a luxury to be able to sleep 8 hours straight. If you were in the jungle or somewhere like that in a more primitive circumstance, you couldn't afford to be awake all night, sleep all night. There could be predators. There could be other problems. There could be, you can't afford unconsciousness for that long. But our culture does that because we have work schedules. So we have to get up at a certain time, work, eat at a certain time, sleep at a certain time, and conform to those schedules, which is not necessarily what our bodies want.
That itself is a cultural thing.
Yes, all of this is yes.
Yeah. So
and add to that the fabric softener in your sheets and on the pillowcase, and all the smells in your bed that you're going to be scarfing in all night that people don't even think about. And if you wear pajamas, should you sleep naked or should you have clothes on? Like if you have clothes on, you could strangle part of your body in circulation as you move in the night because people are rolling all over. So being naked is probably the healthiest thing to do when sleeping. And, that keeps freedom of movement. You don't have anything constrictive. And you should probably have cotton sheets or natural fibers, and don't use detergents that have fragrance and fabric softeners, which leave residue inside that fabric. And that causes that'll get into your skin, and
that's what the smell is if you can smell the fragrance, you need to wash it again with something that doesn't have fragrance.
Exactly. It's terrible.
So I find it so funny. Like, they've got like these commercials for these plug-in fragrance things.
Oh yeah.
And they actually show all this, like, they kind of make all this color stuff. And it's like, those of us that see that as gross, right? Like, that we basically have so many toxins in our environment that, like, why add to it with your clothing and your bedding and your shampoo and your soaps? So and it's really easy to find ones that are safe, but you have to start paying attention. Let's move on to, you've done some thyroid research. And,
this is an interesting one too, and it's again a mechanical thing. If one thing about medicine that makes them not see this is that they don't have any view of the human body as having sort of a design, a plan. That there's no intelligence to why we're the way we are. It's just random. And they think sometimes we have vestigial organs that we don't need, like an appendix, which they're learning we do need.
And can I just interrupt you? Because, we're so pushed on, evolution and stuff like that. And sometimes I'm really challenged. So we have a mallard duck hen that's just decided to build a nest and start laying eggs, like 4 feet from, our kitchen window.
That's convenient.
And so we've looked into it. Well, like, because she's there and then she's not there. So a mallard duck hen will lay eggs like over a week or more. But how do you get the eggs to hatch all at the same time? You don't sit on them. Once she's finished what's called her clutch, then she's on it. She's on those eggs. Well, how on earth could it evolve that a mallard duck not only would figure out, oh, wait a second, I'm not going to sit on my eggs till I've laid them all, and that's going to take me several days. And then that to be evolved, like, so they're not trained this, they just know. And then apparently when the eggs are getting ready to hatch, like, the chicks start making certain sounds and tapping, like they coordinate, because you're not going to live unless most of you aren't going to live unless you all hatch at the same time. I was thinking about this that week. How does that possibly evolve?
Oh, agreed.
I don't get it, right?
Agreed. You look at complicated any social behavior, bees. I mean, these are very hard to explain with point mutations, or complex organs like ears, inner ear, and the eardrum, and how it. Yeah, I agree. I think that the current models for explaining these things are not effective in explaining them. But because they don't see any intelligence to this in medicine, they don't look at the significance of anatomical relationships. And it occurred to me that one of your most important organs is your thyroid. Your thyroid gland produces thyroid hormone that affects your cellular metabolism. A lot of thyroid and your metabolism is turned up, like your thermostat gets turned up, and all of everything goes faster, and you eat more, and you're faster, you heat up. And when you have low thyroid, it goes the other way. Well, this is a very, very important hormone that affects every cell in your body. Why? You would think with an important gland like that, you'd want to protect it. You don't want it to be, out to be hurt, and it should be protected. Its location is significant. Well, where is it located? It's located right here. I mean, right around your Adam's apple. The Adam's apple is the biggest bulge here. It's your voice box, your larynx. And right around the larynx, on the outside of it, I could touch my thyroid right under here. It's like a butterfly around the larynx, around your voice box. Wow, that's interesting. Because the thyroid is filled with a jelly-like material how it stores thyroxine. It stores some of the hormone. And you could manually release thyroid hormone by massage. Massage therapists know not to massage your throat if you have high thyroid, because you're going to make more thyroxine get released by simple manual massage. There are studies that have shown if you're in a loud occupational setting where there's banging and huge loud noise, the workers in those, they get thyroid damage, because the thyroid as a gel-like substance will vibrate in sympathy, resonate with that kind of energy. Well, you're putting it on, it's placed right on our voice box, which is vibrating constantly every time we talk. So that means the thyroid is vibrating when we talk. Well, that must mean that if you there's more than one way of stimulating your thyroid. According to medicine, it's through your brain with thyroid stimulating hormone going from your pituitary. It detects the amount of thyroid. Well, actually, the hypothalamus releases thyroid releasing factor in response to how much thyroxine, which is thyroid hormone, is in your blood. If it's too low, it tells the pituitary to release thyroid stimulating hormone, which does what the name says it does. It stimulates the thyroid to make more thyroxine. That then the brain then sees that, and then it has feedback and lowers the TSH level. So the TSH and the thyroid hormone work together. If your thyroid gets low, the TSH goes up to make your thyroid go up to make the TSH go down. And you try to keep a homeostasis that way, a balance. That is a classic thing. That was the first biofeedback loop, I believe, that they discovered in hormone biofeedback. So they love that one. It's a classic. They never thought that there's a second mechanism for such an important organ as your thyroid for its stimulation. And I believe that's your voice. And by the way, in Ayurvedic medicine, they recognized this thousands of years ago. And I found that, okay, so what if you overstimulate your voice, like you're yelling a lot? You're aggravated. Aggravation and stress are known to increase thyroid release and cause hyperthyroidism, but the mechanism isn't known. I think the mechanism is that when you're aggravated, you tend to yell a lot more and raise your voice, and there's a whole bunch of that kind of vibration going on that overstimulates your thyroid. As you're yelling, you're releasing thyroxine, and that's going to cause transient hyperthyroidism. Now, if you're going through a long period of yelling, that's going to be for a while. Now, let's say you stop talking altogether, the opposite direction, and you stop using your voice. That'll understimulate your thyroid, and you can get low thyroid. Now, the brain will try to compensate, but it has limits to what it can do, and you can start because we obviously get low and high thyroid. So what doctors do is they look at your TSH level, they look at your thyroid level, T3 or T4, to try to see what those levels are and how they relate. But they never think about how are you using your voice. And I'll give you an anecdotal example. When I was living in Hawaii, along the shoreline, there was a man who moved in to the neighborhood, and he had a job where he was an executive telling people what to do. And he didn't like the fact that there were cars speeding along the beach road right past his house. And he owned the little beach across the road from his house. So he felt a real connection. When cars were going really fast, he started screaming at them, slow down. And he did that repeatedly, just policing the cars. I hadn't seen him for a while, and he, like, I don't know where he was. And then I saw him. He apparently was sick, and he told me he developed hyperthyroidism. And he didn't know why. The doctors don't know why. The first thing they do, of course, with high thyroid, the way they look to see how active your thyroid is by giving you radioactive iodine. And that the thyroid will pick it up if it's active. And then they because it's selectively, the thyroid is selective for iodine, but it's not the only organ that picks up iodine, but it does. And you then get a hot thyroid for a while. Mm-hmm. And that's just diagnostic. If they decide then that they want to get rid of your thyroid and give you thyroxine orally as a pill for the rest of your life, they give you more radioactive iodine, and it burns the thyroid off. And it's called ablation, and it ablates the thyroid. Of course, your thyroid's right here, and if it's radioactive with iodine 131, your brain is right here. Your brain stem is right here. So I'm not sure. And what's really weird is they say, well, it depletes real fast. It doesn't stay around. They tell you not to stay around babies, okay, because you're hot. But they'll say that it depletes quickly. There's a quick half-life, so it doesn't stay around very long. But what that really means, if it's a fast half-life, it means, all right, a half-life is how long it takes the radioactivity to decay to 50% of what it is. And then the next 50, so if something has a half-life of 1,000 years, in 1,000 years, half of it'll still be radioactive. Mm-hmm. Well, the half-life of these radioisotopes they use are short, like within days. So that means all of that radioactivity is released within a few days. I mean, that's a lot of radioactivity coming out. Mm-hmm. A long half-life means it's slowly releasing over that time. The shorter the half-life, the more quickly it's releasing that radioactivity.
Right. So ironically, when they say it's got a short half-life, that's actually bad.
I think so.
Yeah, we're firing a bigger caliber than
yes,
the small caliber gun,
and
right?
they use the same thing to diagnose as to treat. So you're halfway destroying the thyroid just by diagnosing the thing. Mm-hmm. Well, once that all goes on, it's too late. I mean, you're going to be on thyroid medicine. But what happens, and I also anecdotally, I've done radio shows on this, and I had a nun contact me and say that when she had to go into a seclusion thing where she couldn't talk for quite a while, she got hypothyroidism. And I've spoken with other people who are like singers. They sing. All their lives they were singing in a choir or whatever. And then there's a traumatic event that happens, a loss of a loved one, divorce, whatever. And then they stop singing. And then they get hypothyroid. And so I've seen both sides of it, where people get aggravated.
Just so people know, hypo is low thyroid function. So it's not being stimulated by the voice anymore.
Right. And so if you're too quiet, so I think the reason low thyroid is so prevalent among older women is because often they're living alone. They get either divorced or they're widowed, their children leave.
So could I get into trouble? Because you were saying, that the singers, and they stop singing because some traumatic event, and then all of a sudden their thyroid isn't being stimulated and they get hypothyroidism. You used, widowed women. Well, they no longer have a husband to speak with. I could have used another term that would have gotten me into trouble.
Well, but that's true. And they told, they then, so a good way to deal with that would be to vocalize, to sing, to read out loud, to talk. In our culture, we don't talk enough anymore. We're texting, we're emailing. We used to sing. If you look at old movies, like from the 40s and the 30s, people sang together all the time.
Well, and families sang together. And I remember that when I was younger. Is there, because now, like, the kids are so involved in their devices as opposed to speaking, are we seeing changes in thyroid patterns in young people?
I don't know the answer to that, but that's a good question.
Yeah.
I
Yeah.
haven't thought about that. But that definitely would affect that and a lot more with the phones. They're just really shutting these kids down. But we used to sing in choir in school. They had choir when I was a kid. There was sing along with Mitch. I mean, singing was pop, dancing was too. But those types of self-expression, I think we become much more um, spectator in our, because of all the media that entertains us. So we don't entertain ourselves together in groups anymore. And the new culture with kids today, people today who can't even communicate,
Hmm.
it's going to be even worse. So our talking has gotten less.
So
And
the important thing though here is you're making the point that the thyroid is likely placed where it is by design.
yes.
It's meant to be stimulated by sound. And if that changes, so let's say you've been living with somebody, you've been having conversations, and all of a sudden you're not, or you've been singing a lot, and all of a sudden you're not. Be aware that you actually need to be stimulating the thyroid with, so either start singing or start breathing out loud or whatever. But it's a factor, actually a physical factor that you need to be aware of. So if all of a sudden you're starting to have thyroid problems, perhaps you can reverse it or start
Mhm.
stimulating by more
Exactly.
sound.
And conversely, if you're high thyroid, you should look at what have you been yelling? Have if you're screaming, like going to ball games or sports events and just getting in it, or being aggravated and yelling as a result of the aggravation, long-term aggravation like marriage problems, and they're yelling at each other and just getting aggravated, that could shoot off too much thyroxine. And so what you need to do is shut up for a while, calm down, don't use your voice as much, give your thyroid a chance to heal. So in one case you need to more stimulate, in the other case less. And while this hasn't been studied, by the way, they have studied since I came out with this. There was a study where they took thyroid cells in tissue culture,
Hmm.
stimulated it with auditory vibrations from sound, and it caused them to secrete thyroxine. So it shows sound causes secretion and everything. And they had the same theory I had, that it's on the voice box because it's getting vibrated for a reason. And I think what happens is since you have at least these two factors of voice and brain controlling the thyroid, then as you grow up, you probably develop a certain style of vocalization. Like you're either a talky person or you're not, extroverted or introverted. Introverts probably have a higher, if they speak less. I mean, they could be an introvert and be a radio announcer, but let's say they're an introvert and as a result, they're kind of shy. They don't talk that much. My guess is they have a higher brain component affecting their thyroid,
Hmm.
higher TSH to compensate for that. But people who speak more will have a lower TSH if you look at a whole bunch of people on this. And but you zone in on what you're optimal, what you're used to. And as you get older, if you diverge from that, that's when your body isn't ready for it. So you could be loud all your life and you're fine. You may never get thyroid problems because you're used to that. But if you're quiet all your life and then you start yelling, you're not ready for that, and then you're going to overstimulate your thyroid because it's already getting plenty of brain stimulation, because that's the other factor. You see what I'm saying? So there is more
Hmm.
than one. It's not just endocrinology, which again, medicine is biochemistry. Their answer to this is get rid of your thyroid and we'll give you pills. But that's not a good answer. That's not physiologically what your body is used to. And this is another mechanical issue. So we've talked today about compression from tight clothing, not just bras, any tight
Hmm.
clothing, anything that leaves a mark in your skin is affecting circulation. If you don't circulate, you deteriorate. The part of the body that doesn't circulate can't get what it needs, and it can't get rid of its waste products. Anything, whatever you're wearing, a tight belt, tight neckties affect brain circulation, obviously. It cuts down, it
Hmm.
impinges on the veins. And there was a study that showed that it affects the brain, increases brain pressure by wearing a tight necktie. Tight belts, oh boy, what they do, the colon goes above and below the belt line, and the lymphatics have to drain up to the heart. And the parts of the colon that have the worst cancer are on below the belt line, where it can't drain properly. So there's so many examples of, And people have to be aware of tight shoes. I'll finish it. I'll
Yeah, let's
get
talk
back to
about
that
shoes.
one.
That's the I was kind of waiting to get to
Yeah.
that, because
Well,
that's one thing that really kind of concerned me when I first heard you speak about it.
well, shoes are really toxic. Of all the clothing we have, they're the worst. You know it when you go into a shoe store or into the shoe section of a big department store. You could smell it. And there, the a number, if you look it up online, the number of chemicals that go into shoe manufacture, it'll blow your mind. There are like so many. The list is huge. And these are gnarly chemicals because you got leather tanning and all the leather preparation stuff. You have all the glues. You have, the dyes and the conditioners and the this and that's. There's a huge amount of chemicals that go into shoes. Now, your feet are sitting in those shoes all day. And if they're tight, that's another issue because shoes can throw off your toes. And, if your foot has toes that bend in, that's from your shoes being pointed because they end up distorting your bones in your feet. Your feet should actually, the toes, it should be the widest point is at your toes, not the narrowest. But the shoes are pointed. So they make our feet compress, and it causes problems, hammer toes and bunions and calluses, and it throws off your ankle and then your knee and hip and back. And it's just really a terrible thing with shoes. High heels, they're crazy. Our culture is crazy. It puts fashion before health. I mean, it's obvious tight high-heeled shoes are not good for you, but we use them anyway. So that's a culturogenic problem. The culture doesn't care about those things. Why? Now, you're wearing socks with shoes, hopefully. If you're not, your feet are going to sweat and soak in all those chemicals. So let's say you're wearing socks. The socks you're going to sweat in your socks, and you're still going to soak in a lot of those chemicals. Plus, the socks are really tight at the top above your ankle to not fall down. Elastic is evil. Socks hold on by elastic. That's going to affect your foot lymphatics that have to drain up against gravity to go back to the heart with the fluid in your skin cells. Your skin tissue has to drain its lymphatics. Once it gets to that constrictive point of the sock, it's not going to easily get past that. And when you take your shoes off, you notice there'll be big indentation where your sock top was. Everything below that is relatively congested in the tissue, in the skin tissue, compared to above that, because of that dam that blocked the flow of lymph. Now, your feet are soaking, your skin is soaking up these toxins. Normally, if after that, if you didn't have constrictive sock tops, your skin would drain those toxins through the lymphatics, because that's what it does. It removes toxins from the tissue, goes to the lymph nodes in your groin, eventually works its way back up to your body and into your heart. And if you have any, the lymph nodes fight infection, cancer cells, whatever's going on. And they're like a filter that checks the lymph fluid that's draining from these tissues looking for problems. And if there's problems, it makes white blood cells that goes and fights it. And the whole transit way of this is the lymphatics. That's why if they're blocked, your whole immune system gets screwed up and you can't fight things as well. So here you have now a damaged immune system because your socks are tight. Your shoes may be tight too, but your socks are tight, impairing your lymph drainage from your feet. Your feet are soaking in toxins, many of which are carcinogens. And it's no surprise then that one of the highest sites for melanoma, which is a rare skin cancer, but that's the dangerous one. That's the one that could spread and kill people, melanoma. One of the highest sites for melanoma is on the bottom of the foot. There's no sun there. It's not due to UV. Why would they have that? Medicine doesn't know why. It's obvious why. It's because you're soaking in toxins and you can't flush it out of by the lymphatics because of tight socks. So we're creating foot. That's why you also get fungus on your feet. And I mean, the entire immune system on your feet gets screwed up because of the clothing we're wearing. Clothing is an invention, and if it's tight, it starts to actually become an anatomical appendage. It starts to function as an anatomy addition to your body. So it's like an external shell or a ligament that holds things tight. People wear these days. They like really tight clothes for bicycling and yoga, and like it's got to be skin tight. The skin wasn't made for tight on the outside. It's soft on the outside on purpose. Its circulation relies on subtle forces from within the body, like heartbeats and muscle contractions and body movement and breathing, which creates negative pressure in your chest cavity that pulls blood. All of those factors are what you rely on for circulation. You start putting on artificial things on the outside of your body, which never had that before, and you're going to start affecting circulation. And if it's tight enough, and like an organ like the breast, it'll just really affect that entire organ. So, and a bra is like the tightest thing anybody wears. So you got a really intimate garment that your skin is soaking up whatever's in that garment. So if it's toxic, if it's made of polyester, that's plastic, like the same exact plastic that's in your water bottle, which you shouldn't be drinking out of, by the way, that leaches plastic residues into the water and into your skin. They actually take water bottles, they mash them up, and they recycle them, and they can make bras out of them as polyester. It's the same polyester, exact same chemical in a different form. So you're wearing plastic adhered to your skin, tight. I mean, come on. So
what's that one chemical that's in plastic? Like some water bottles
BPA,
say we're BPA free.
Right.
So
that's
the
only
thing that
one of
gets
them.
me is, and this is cultural, it's marketing. So you don't want this BPA. So, you want to have water bottles that are BPA free. But now it's marketing. I see it like on spring water, 100% recycled bottle. Well,
No,
how do you know
want
that? You can't know that's BPA free then? Like, it's just kind of like, that's as gross as can be. But it's a marketing thing. Oh, I'm going to buy
recycled.
this spring water because it's 100% recycled. It's like, no, no.
Those break
Bad
down
idea.
they break down worse than the unrecycled. The recycled is not a good thing. This is all marketing, and you shouldn't ever, by the way, as long as I mention those bottles, don't ever put them in the sun. And people don't realize that. And when even fluorescent lights in the grocery stores have UV, that breaks down the plastic. UV breaks down
you can you can taste it. Like when like at our home, we have a whole house water filtration system to get rid of the chlorine and stuff like that and the fluoride. But when we travel, we got to buy bottled water. And, if we don't have a rented car or something, or some places they don't even have, those thick blue bottles. So let's say I bought Fiji or that French one. Sometimes it tastes fine, but other times I can taste the plastic, and I know that the bottle has been exposed to heat or sunlight.
Absolutely. And people don't realize that they can't do that. That when they make those plastic bottles, they make them for certain conditions, to withstand certain conditions, to say these are good for that. But they know the condition says it's not exposed to direct sun or heat. So if you have that bottle in your car, you're drinking water, and you leave it in the car on the dash or in the middle, and the sun's shining in on your car's toasting in the summer, that bottle is toxic. So
yeah, and if you can taste it sometimes. So if you taste it, stop drinking.
Oh yeah, for sure. You shouldn't even taste it, because that just avoid those things altogether. But the interesting thing, when we're talking about causality, we started off talking about causality, and here we've come up with a lot of lifestyle causes. But you see, you can get deeper than this, because a lot of lifestyle caused diseases are tolerated. So that means the cause is deeper than that. Like, for example, tobacco and alcohol. They're known causes of problems, many problems, and yet the government taxes them, so it's got an investment in them, and people use them. There's warning labels on them even, and people will use them, and it's encouraged. So our culture doesn't put health first. And I think that's something that was a shock to me, because I personally put health first. I remember, the expression, your health is your wealth. And that's, you got to put your health first. You can't be happy without good health. And our culture doesn't do that. What's more important is industry and making money. And the burden of proof is on people like me rather than on these industries. There's no precautionary principle being exercised here. And, in a capitalist culture where you're trying to promote product and you don't want to hurt nascent industries, you wait until there's an actual, obvious, can't hide it anymore problem. And that's why, cell phones and brain cancer, or, all of these things, they don't first test their products to see, will it cause a problem? That's the precautionary principle. I'm sure you know all about that.
Well, and let's, you're touching on a nerve for me, because Cell phone, you can choose whether or not to buy a cell phone. Now, you can't choose to live in a city without cell towers.
That's
But when
true.
the government forces us to put smart meters on our homes,
Hmm.
and like governments used to adopt the precautionary principle. So, again, if somebody wanted to opt or something, but when they mandate basically things that really there's so much evidence that we should be, the most generous thing I can say is we should be cautious. There's so much evidence that if you don't have two neurons firing at the same time if you don't think we should be cautious with it, and instead they impose it.
Yeah, that's
And
right. That's a
so when,
culturogenic problem. And that medicine makes money when you're sick, not when you're well. So when these diseases come up, medicine is focused on trying to early detect and treat rather than prevent, because
Mhm.
prevention means you don't go to them. So they're not into prevention. Doctors should stay away from prevention. That's not their business. We should have
I think
preventative doctors.
I think there was a time in ancient China where doctors could only get paid if you got well.
That makes more sense.
Hmm.
Although I don't want to give them that much control over my life, because
Yeah,
then,
no. I get that, but you've emphasized that we've got this profit
yeah,
model. You used the
yeah,
example with cancer screening and testing when we were talking about bras,
yeah.
and it just seems that it's such a big business model
Oh,
that
absolutely.
our incentive system is actually turned against us. Like human, we just act what's in our best interest, even if it's subconsciously. Um, that I think we always need to be mindful to try and have positive incentive systems.
Well, the
So,
biggest problem that makes this really depressing for me is AI, because
tell us about that.
oh God, it's so sad. I know it really well because of bras and breast cancer. I'm always asking AI about it to see what it says, and because the mainstream has established in their minds that this should never be looked at and this should be buried and ignored, and they're ignoring the studies that are out there, and they make a statement: there are no studies. The Canadian Cancer Society, there are no studies that show bras cause breast cancer, whether they're worn to sleep or whether they're tight, whatever. They're totally safe and innocuous. Don't worry about it. That's totally false. There are lots of studies, but you can't fight them because they're the authority, and we live in an authoritarian structure for medicine.
Hmm.
So what happened is AI is trained on their bullshit, and as a result, it'll tell you all the lies that they're telling you and stick
Hmm.
to it like no human can stick to it. Now, I've been
Well, even
actually,
the search engines too. I mean, like they are like Google and stuff like that. I mean, they bury anything that goes against the mainstream narrative. And I find when I'm, preparing for guests, I'll get a whole bunch of articles that explain to me that they're, fraudulent and they misrepresent and blah blah blah. Like I'll get these attack sites, and I have to dig to actually find,
oh yeah, absolutely.
reasonable things. But I think a lot of people understand that, and it's just it. But the amount of kind of censorship and the fact that these powerful interests that have an interest in this, pharmaceutical surgery medical complex also are the largest advertisers of all forms of media, and that influences the media. I mean, we could just go back to Noam Chomsky, I forget the other author of Manufacturing Consent, where they kind of list the different factors that just affect the media. Like
Mhm,
it's just
mhm.
the way it is, and advertising is one of them.
Well, at least
Surprise, surprise.
when there were search results, you could look and you had to sort of
Hmm.
think a little bit. With AI, it gives you a definitive, this is the
Hmm.
answer, without any. And how many people are going to go deeper? I mean, it may be maybe 10% of people will challenge something or go deeper or ask more questions. Most people will just accept what AI just said to them, and it says it with authority. So I think that's a really big problem,
Hmm.
because I've seen myself how it lies, and I could talk to the AI and show it things, and it'll eventually come around. But it forgets it because it doesn't learn from your chat. Only within your chat will it learn. But once you go into a new chat or another person asks the same thing, it goes to its default. It doesn't learn
Right, right.
outside of your chat. So you can't teach it a thing outside of your one relationship with it in that chat. And so it's very frustrating. Like I go through a long thing of showing it, and it's fighting with me and making up things. It hallucinates studies that
Oh,
don't
absolutely. I've
exist.
run into that. Yeah.
Oh God, it'll say there are many large studies that have found no link with bras and breast cancer. And you say, really? Name them. And it'll say a nurse's study, whatever. You say, did they look at bras? Well, no, they didn't really look at bras. I mean, so it's like making this, they didn't even look at the issue, but it's saying, no, it wasn't there. And you can get it to admit the lies, but it actually is. I saw something, one of the AIs just told me about how Google has, I forget the name of it, but there was this agreement that it has with medical information that if it doesn't have a qualified, recognized authority as part of the website to say a medical thing, it just hides it. So you got to either be a doctor or a medical facility in order for your comments to be picked up by Google. So that's why you can't find things that individuals say that are outside of the mainstream. So it is a better gatekeeper than anything has been. It's just making and the average person isn't going to challenge it. So I think that bodes ill for so many things because the medical model is so limited. It's limited to biochemistry. It doesn't see us as any different than rats. It doesn't appreciate anything about human culture and how that affects physiology and anatomy. It affects so much of who we are. You can't understand people. I think it's ridiculous when you look in a medical textbook on anatomy. You look up an anatomy thing and you'll see a naked body, right? In an anatomy, a picture, it'll show a nude body and different parts of it for the anatomy. But people don't exist that way in our world. People aren't naked like that. They're wearing tight this and tight that and tight that and, you know, all the clothes you're wearing. That's part of you. It affects the way you circulate. It affects how you move. It's shoes that affect the way your feet work. And how can you understand feet? Why are you showing me a chart of naked feet when every one of us is put in shoes from infancy? And then our feet are like constantly foot binding. We're victims of foot binding like the Chinese who did it for 1,000 years for sexual gratification and to keep the women hobbled. And they actually, their toes and their foot binding, you should look that up on YouTube. You'll see images on Google Images of foot binding. They wore really tight shoes. Their toes would literally rot off. And the men would find it erotic to take the shoes off and wash the feet of these women. And these women couldn't get around. They couldn't trust them. They didn't trust the women. So they hobbled them to make sure you're not going anywhere. And it was an enslavement. And it was considered fashionable. Women wanted it. Just like with bras. Women know they're not comfortable. They take it off the first thing they get home. They hate them. But they've been so conditioned to wear them from childhood onward. They're brainwashed to thinking I need to have a bra. I can't go out without my bra. Oh, my God. And worse yet, my nipples may show through my clothes. That is like a catastrophe. And, you know, that kind of brainwashing is the culturogenic component to all of these diseases.
You have a voluntary study on the bras that people can participate in.
Yes, I do.
How do people access that? And then I'm going to go to my next point. So first, how do people access this?
That's on my website. It's free, and it's called brafreestudy.org or .com.
Okay. But one of the things from our other show, so brafreestudy.org, one of the things in our other show is that study is showing that women actually get comfortable with not wearing a bra. It's like there's a whole bunch of surprising health benefits that they're reporting, but they're also psychologically finding themselves that they get comfortable and confident again.
Yes, they become liberated. A lot of them say that because they really feel, I think we as men don't really get it, how a woman feels being conditioned all of her life to feeling that her breasts are their most important asset. And they just have to augment them, and they're willing to go through surgery. They're willing to put up with constrictive bras that make it so you can't breathe. That's one of the things women said in this study. When they stop wearing bras, they can actually breathe better because they can expand their chest. So it's affecting their respiration and their heart then. Also, it affects digestion. It affects their menstrual cycle. It affects melatonin secretion. I mean, there have been studies that have been done that show that tight garments, tight bras, and tight girdles affect your entire body, your autonomic nervous system, and everything. It's not like your body ignores something that's tight, because that can harm it in the long run. It knows it. So you're uncomfortable, but our culture trains us to put up with the discomfort. That relates to
Yeah. So
another thing.
the
Yeah.
point you're making is this is not a small deal. Like, I mean,
Oh,
it it is not a small deal. Wearing tight clothing, particularly bras, is not a small thing. It is going to hurt you and
well,
is hurting you.
men know that with tight underwear, they can lower your sperm count if it's tight and heats up the testicles. It was also suggested that can cause testicular cancer. I'm not sure how well that was proven, but it certainly causes infertility and sperm problems. Your body is designed the way it is by nature, and our culture gets in the way, often because fashion is about tweaking your body to make it look different and weird. And it depends on what culture you're in. In some cultures, breasts are supposed to be high up on the wall. In some cultures, they're supposed to be low. I mean, in Africa, it's a sign of fertility and fecundity to have, pendulous breasts, because you've been nursing a lot of babies. And some of those cultures actually hang weights from the breasts to make them go down. Or they wear straps. They have the babies on the back, and they have a strap that holds it like in a backpack, and that strap goes right across their breasts, squishing them down. So every culture has its own weirdness. None of them, it's just that you as an individual have to realize that your culture is not your friend. You're like one cell in a huge organism, and cells are often, I forget the word I'm looking for, but they are easily discarded and used and exploited. Even our own bodies, we put up with things that some cells suffer so that the rest of the body can go on. And as far as the culture is concerned, you're just one cell, and your life is not really that important. If the whole system relies on bra usage, because we have a multi-billion-dollar bra industry, we have a multi-billion-dollar breast cancer industry. The fashion industry is connected to that. The way we look at women, the way our sexism, our relationships, our self-identity, all of those are connected to breast shape, which is connected to bra usage. I mean, it's mind-blowing. And that's causing
It
disease.
it truly is, because yeah, I mean that we alter ourselves so significantly because we have this perception
And if we
of the
all do it,
importance of that.
and we're all doing it, so you can't see any comparison. If everybody does the same thing, if everybody smoked, we'd all be coughing. If everybody wears tight shoes, all of our feet are distorted. If every woman wears a bra, they're all going to have breast pain and breast cysts and, higher cancer rates, than they should if they didn't have a bra. That's why you need to have compare to people doing. So what I tell people to do is, these are lifestyle things. You don't need a prescription for this. There's no risk. It's free. Try, don't wear any tight clothes. Stop wearing your bra. Don't wear tight socks. Get diabetic socks. That diabetics have, known circulation problems. So they have socks that are looser at the top. Get those, and it won't be as constrictive. Once you catch on to that sock thing, you realize how tight. Everybody must have marks from their socks when they take them off. They're all so tight. Diabetic socks are a lot better and softer. Be aware of your shoes, and don't wear toxic shoes. There are shoes that are less toxic than others. Don't wear anything tight. If it feels uncomfortable, it's bad for you. And I mean, this is in addition to like nutrition and all those things that's mostly what lifestyle people focus on, exercise and nutrition. But when it comes to exercise, they'll tell you to wear a sports bra and wear these elastic clothes, because they're all marketers. They're all looking to sell you something. And, this is free. This is free information that you can do and empower yourself. Raise the head of your bed. See how that makes you feel. You'll know the difference. You will know. You feel better. You don't need a doctor to do a study, to do a test on you and say, well, yeah, your markers are looking better. And people feel like they don't know if they're healthy. That's another interesting thing. Can you know whether you're healthy without a doctor doing a test? Does feeling healthy mean you're most likely healthy? Or are we incapable of self-assessment, and we need to have medical diagnostics to let us know that we're healthy? I mean, that's what.
Or misrepresenting. I remember reading a study where they, I think it was in 3 hospitals, they had pathologists do autopsies on just the first people that died in each hospital. Like, just we're going to take a certain number, and they weren't given the medical files, and the pathologists were, tell us why these people died. And over half of them were being aggressively treated at the hospital for conditions they didn't have.
Yeah, iatrogenic is a big thing. Doctor caused problems.
Yeah.
Absolutely. And getting tests that you don't need, tests give false negatives, false positives, I mean. And they give false negatives too, but they give false positives, and that sets you down the road to, treatment that you don't even necessarily need. So really the best advice, I remember Dr. Mendelsohn back in the day, I forget his first, Felix Mendelssohn? No, that's the composer. You remember the Dr. Mendelsohn? He wrote Confessions of a Medical Heretic.
Oh, yes, I do.
Yeah, that was an awesome book. I read that when I got out of medical school, and I said, right, this is what I want to do. I mean, he was showing all the problems with medicine, and that, if you don't need a study, you don't really want to go get one. And if you look at what options you're going to do with this, if the study comes back, what is it going to make you do? What treatment options are there? It may be that you don't even want any of those treatment options. You want to leave it alone and let it get better by itself. So you don't need to take those tests. But tests are expensive and they're promoted. And nowadays you can go into a test center without a doctor's prescription and just order tests. You can order genetic tests, which will tell you what diseases you're going to get, which is terrible programming of your brain with these tests that are predicting, like tea leaves, what you're going to get in the future or what you're high. I mean, that sets people up for disease. That's another problem.
Sydney, we're getting to the point where we've got to end the program. I'm hoping that this is opening people's eyes that we need to start considering cultural factors. And, I think a lot of people, this will be brand new to them. Like even just the idea that sleep elevation, the idea of, maybe paying attention to tight clothing and how significant that is. And, maybe you should be buying shoes that, aren't going to be so filled with chemicals, things like that. I want to thank you for coming. I'm so pleased that I was able to track you down, and so pleased that you're so, willing to come on the show and share with us.
Well, thank you, Shawn. Thank you. And thanks for being a venue for getting this information out to people.
Yeah, no. So on behalf of the NHPPA, I just want to thank you for coming and attending today.
Thank you.